Institute. Welcome to yet another engaging session of our scientific forum, Immunize Talk. At Human Biological Institute, we take immense pride in driving several public health awareness initiatives through our one of its kind platform, Immunize with Pride. Immunize with Pride is an awareness initiative dedicated to educating the public about vaccine preventable diseases and the importance of timely vaccination. This session features leading experts across the country who share their valuable insight on key health topics aimed to raise awareness and promote overall well-being of the society at large. Today, we are delighted to have Dr. Shalu Goyal with us to share her expert perspective on the invisible threat, reducing hepatitis A risk in high exposure environment. I shall be sharing more about our today's speaker in a short while. For the moment, please allow me to share a brief introduction of Human Biological Institute. Human Biological Institute is a division of Indian Immunologicals Limited. IIL was established in 1982 by the National Dairy Development Board as one of its units and was later incorporated as a company in 1999. HBI was founded in 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. Our first manufacturing facility was set up in Ooty. This facility is one of its kind in India and rolled out the country's first varicella culture rabies vaccine in the year 2000. Today, we are a leader in the ARV segment with presence in around 60 countries. HBI has launched several other vaccines and became a major player in the human vaccine segment. HBI has been a key supplier of the pentavalent vaccine to the Government of India under its Universal Immunization Program. In yet another milestone, HBI introduced Havishur in 2024, India's first indigenous hepatitis A vaccine, aimed at providing protection for both children and adults. With the vision of shaping global healthcare by spearheading the One Health initiative and the mission to innovate, produce, and market quality healthcare products and services to improve and extend lives. We are committed to providing affordable, high quality products through continuous technical innovations to meet our customer needs. As a market leader, we have taken a significant step towards reducing plastic burden by 160 tons per annum through the introduction of eco-friendly packaging for our flagship brand Aberab. As a part of our corporate social responsibility initiatives, we have adopted schools where IIL provides infrastructure, support, and basic facilities, including assistance with the midday meal program. In association with NDDB through the Gift Milk program, hundreds of school going children benefit from daily milk nutrition. We have also donated an oxygen generating plant to Telangana Institute of Medical Sciences and Research. These are just a few highlights about IIL. For more information, please visit our website at www.indianimmune.com. Immunize with Pride is one of a unique initiative which emphasizes that vaccination not only protects individual but also strengthens community immunity. Welcome to our today's episode of Immunize Talk. This session is dedicated to a highly significant topic, the invisible threat reducing hepatitis A risk in high exposure environment. Let's have a video for the speaker who is going to we are going to have with us. We are pleased to welcome Dr. Shalu Goyal. Dr. Shalu Goyal has 9 years of clinical experience in pediatrics and child health. She has completed her M.B.B.S from prestigious SB Medical College and PBM Hospital, Bikaner, and went on to pursue her MD in pediatrics from SMS Medical College and Hospital, which is in Jaipur. She is also certified in allergy and asthma training, adding valuable expertise in managing respiratory and immune related disorders in children. Dr. Shalu Goyal currently practices at the Advanced Child Care Clinic in Faridabad, where she's also known her for calm, compassionate approach and strong commitment to preventive child health. So, welcome, ma'am. Good afternoon.
Thank you. Thank you so much.
So, ma'am, as our topic says, the invisible threat. So, and it is reducing the hepatitis A risk in high exposure environments. So, what is hepatitis A? We will start with very basic things like what is hepatitis A and how it is also called an invisible threat.
Basically, hepatitis A is spread through hepatitis A virus. It is
Yeah.
called invisible threat because in especially in pediatric age group, the disease is mildly symptomatic or asymptomatic. Many a times, parent doesn't know child is having hepatitis A, but the children spread it unknowingly. So it is invisible. Babies spreading this without knowing that I am carrying a disease. That is why it is called silent. And the time when symptoms appear, it is very late.
Okay, so ma'am, as you are saying that it might be missed, so what makes it so easy that we miss this at the earlier ages?
Because immunity in kids is still developing, so their immune system doesn't give them so much response to that virus, so the symptoms are very mild. Now initial symptoms are almost flu like symptoms like fever, nausea, vomiting, which is very easily missed.
Okay, so it is basic symptoms which we might get confused with the other diseases or might ignore sometimes.
Yes, exactly.
Okay, so ma'am, like which environments are considered as a high exposure for this then?
See, this is a disease spread through fecal-oral route. So, anything which shares food and water
Yes.
in facilities, like in a crowded area where food and water is shared in between, other than this, sanitation facilities is uh, this is shared also in slum area where open defecation is practiced till now, and there is no proper garbage and sewage proper disposal. So on in these areas, this is very highly spreading because of this contamination of water and food, like in daycare, schools, hostels, sorry, and these food street vendors.
Okay, so ma'am, like this say not clean, unhygienic environments we can say, or the unhygienic habits we can say.
Yeah,
So both can contribute.
definitely.
Okay. So, ma'am, like as you mentioned, orophycal route is the way of spreading it. Other than then also like it can spread in some other means.
Hepatitis A is mainly spread through fecal-oral route. Very rare
Okay.
with other. Hepatitis
Okay.
B or these can spread through blood routes and all, but this is the major route for hepatitis A.
Okay, ma'am. So as we compare to the cities and towns, like which are more susceptible to get this vaccine and this disease, like how they can spread it.
See, there was a time when it was called a dirty area disease, but this has now changed. Basically, in cities also, this is spreading because of the contamination of drinking water tanks with the sewage water, or in cities, there is a shift towards street foods. So, you never know what kind of water they are using, what kind of hygiene habits they are practicing. So this is also spreading in cities as well as in towns. In towns, there are no much facilities for hygiene practicing. So this is basically was a town disease, but it is now spreading in cities also.
Okay, so what people have this perception that it is linked to poor hygiene is very true, and people have
Yes,
that. Yeah.
this is actually a poor hygiene habit disease, but
Yeah.
nowadays it is shifting. Even a clean looking hotel can spread this also.
Okay. How is that possible, ma'am? Like, can you little tell us?
Yes, just suppose there is a hotel which is very clean looking, but there is a food handler who is a carrier of hepatitis A. He is spreading this in so many foods, or there is a water tank contamination with the contaminated water. Then also they are spreading this. They are not disinfecting their toilets very frequently, so they can also spread through that also. So it is not about visible cleanliness, it is about not being healthy areas.
Yes, definitely, ma'am. So, ma'am, what should we look for an early symptoms like parents specifically they should watch for the children's? What are the exposed high risk environments? What we can say?
High risk environments are mainly these daycares, schools, hotels, food street vendors. These are high risk areas because in daycare and schools also kids are sharing their water facilities and toilets and toys. And in hotels, we are sharing foods made from a single food handler. Okay, so
Yes.
these are the high risk areas, and the initial symptoms I already told you that these are flu-like symptoms like fever, nausea, vomiting, tummy pain. If kid is having persistent tummy pain or dark color or yellow color urine or the stool color, matlab like potty color is going towards whitish color, so parents should take a watch on this and they should consult their doctor why it is happening because yellowish coloration in eyes comes later
Yeah.
than these symptoms.
Okay, ma'am. Ma'am, similar symptoms we have to watch for adolescents and adults also.
Yes, actually, adolescents and adults usually have severe symptoms and early symptoms because of their immune system.
Okay. So, ma'am, like, why do we see that adolescents and adults tend to face more severe hepatitis A than younger children's?
The kids are having their immunity developing, and
Okay.
as the age grows, the immunity develops more. So when a kid get infected, its immunity reacts less, so they have lesser symptom. In turn, in case of these adolescents and adults, they have more mature this immune system, so they react more, they give more inflammation to liver cells, and so in turn they have more symptoms. Even sometimes they'll end up in acute liver failure also.
Okay. So it can get severe also.
Yes.
Okay. Ma'am, so what hygiene practices can a family adopt to reduce the hepatitis A, like outdoors and at home also?
See, the bestest and the most important thing is hand wash. Hand washing with soap and soap water is most important hygiene habit, a parent or a person can follow. Second, when you are buying veggies, foods, and other things from outside, just wash it thoroughly with a clean water, either from RO or use boiling water. Don't try don't to use these public toilets and try to avoid these food street from street vendors.
Yeah. Ma'am, so basically, not eating on the like, even though if we cannot avoid such situations when it comes, but until and unless it is very important, should avoid that. And hand,
Specifically, open food like chutney, salads, and
yes,
in juices, you don't know what kind of water they are using, and this ice thing. Ice
yes,
is specifically made from tap water and these
yes,
street food vendors. So
exactly.
try to avoid at least these.
So yes, ma'am, as you are mentioning, so safe water also plays very important role. Otherwise, it is very easier to get infected with the water also. So, ma'am, how vaccination now we will come directly to the vaccination as we are getting the steps like hand hygiene, sanitation, this like proper food. But apart from this, vaccination also does it play a major role?
Yes, definitely. See, what we do in vaccination is we are injecting either dead or inactive virus. So the
Yes.
kid's immunity will look at as a threat. Then it will make antibodies against this, and these will create a memory antibodies. So
Yes.
whenever the kid will infect with a live or active virus,
Yeah.
this memory antibody will react to that, and it will finish it before it infects the liver cells. So this is how vaccination prevents this spread and also the disease of
Okay.
this hepatitis A.
Ma'am, what are the doses, like when we should take it and how many doses are required?
Ideally, it should be started at 12 months of age, like 1 year. First dose at 1 year of age, and the second dose is around 6 months or 18 month of age, 18 months later to first dose. These two doses give lifelong immunity mostly, and other than that, you can even catch up vaccination.
Yeah, as we say that, like for the older children and the adults who have missed the vaccination, the later part they can have a catch-up vaccination.
Yes, they should even, because I already told you that adults have more severe symptoms than children. Second thing, adults
Yeah.
are more even prone for these foods, street foods, and also they are going in hotels or traveling somewhere. So they are even more needing this
Yes.
vaccine.
Yeah, ma'am, actually, there are myths also regarding this. Like some parents believe that once they have their child have got infected with the jaundice, they're automatically immune. Like, is that also true, or is it
No, no,
myth only?
definitely not. No, definitely not. Jaundice have so many reasons. It is not just hepatitis A which is causing jaundice.
Yes,
Jaundice can be because of hepatitis B, C, E, or any other liver infection, liver diseases. So
yes.
even only if a certified lab is saying it is because of hepatitis A, it is
Okay,
not sure that patient is immune to hepatitis A if he has jaundice once in a life.
okay. So, ma'am, have you like came across any myths or the conception, misconception that would have known that parents had heard about it and they are not taking the vaccinations or something like that you wanted to share?
Definitely, so many myths I'm having. So the most important is कि वैक्सीन की क्या जरूरत है मैम, हमारा बच्चा तो पहले से ही फिट एंड फाइन है, उसके अलावा हम तो बाहर का खाते ही नहीं है. द मोस्ट हिलेरियस वन वाज, हम बाहर का मैम पहले हम चखते हैं, अगर हमें ठीक लगता है तो ही हम अपने बच्चे को देते हैं. तो इट
Okay,
डजंट मीन दैट टेस्ट इज बेटर, दैट इट मीन्स द फूड इज सेफ. It's not so.
true. So basically, from clean and hygienic and most preferred home food, we can say
Yes.
at least we should avoid it as it is possible.
Yeah, even home food can also be dangerous if you are not practicing hand hygiene.
Exactly. So, ma'am, if a family member gets hepatitis A, what precautions should others in the house or what precautions we should get to not get this hepatitis A?
See, first of all, whenever you are caring for that patient, you must wash your hand properly and repetitively.
Yeah.
Second, just separate his sorry, separate his belongings like towel, toothbrush, or bed sheets, utensils. Other After that, you use separate washroom if possible. If not, then use disinfection after every use of this patient.
Yeah.
And most important, patient persons who are not even infected, they should get vaccinated for this hepatitis A so that they can be avoided with the disease.
So, like that, we can at least have a precautionary measures.
Yeah.
Ma'am, so like there will be comorbidities also, like diabetes and other for example, diabetic patient. So are they are on a higher risk of getting infected, or if someone is traveling outside, or any like as you mentioned the food handlers, but out of this like these two are like on a higher exposure or higher
Yeah,
risk.
definitely. Diabetics have 40% more higher viral replication testing, and travelers and food handlers are more spreading this disease. When you are a carrier and you are traveling somewhere, so you can give the disease to their people also. And food handler also having this thing, you are giving your food to others, so
Yes.
all the people having your food can get infected. So these are the more prone people and who should get vaccinated.
Okay. Ma'am, actually, I just saw the questions in the chat box that missed vaccination, as you mentioned. So, how this missed vaccination can be helpful?
Missed vaccination is helpful same as the actual vaccination. The thing is, this is it is just delayed. So whenever
Yeah.
you get this knowledge of this hepatitis A vaccine, just get it done. 2 doses, 6 months apart. It is helpful. Same in at the actual age. Better you get it as early as possible. But the
Okay.
basics
So,
are the
like,
same.
yeah, basics are like at the time of vaccination you take it. Otherwise, later on, whenever you get it, it is a safer only.
Yes, safer and effective.
Yes, ma'am. And how hygiene practices can helpful be in hepatitis A, as you have already mentioned, but just you can say that.
Hygiene habits, just as I told you, that wash your hands with soap and water every time you have food, and teach your kids also this thing. Second, whenever you are buying something from outside, just wash it thoroughly with clean water or boiling water, because boiling water for 1 minute can kill this virus. Next, just keep your washrooms clean. Don't use public washrooms, and uh, tell your kids also that don't touch the surfaces of any public places, and just use hand washing habits in your kids, because hepatitis A virus can stay on a surface for weeks if it is not disinfected. And kids having a habit of keeping their hand in mouth, so it can spread very easily in them. So just tell them, teach them not to touch surfaces and not to take their hand in mouth after touching public properties.
Yes,
Other
ma'am.
than that,
How this?
yeah, continue.
Yes, ma'am. So, ma'am, as you were mentioning, like how the schools and daycare centers, what have how they are so much high at risk for spreading this
Because
hepatitis A.
they are sharing toilets, so many kids are using same toilet. If one kid is infected in them, they it can spread disease to many. Other than this,
Yeah.
they are also sharing water facilities in hospital schools. So same, one kid is infected, it can affect many others also. In daycare also, kids are sharing toys. Same,
Hmm.
they are touching the surfaces, they are taking their hands and mouth, so it can spread like this.
Okay. Yes, ma'am. Ma'am, so basically, hand hygiene, maintaining proper like cleanliness around us, eating the clean and sterilized, what we call food also, and so this all are the measures, and especially vaccinations, which can help you for
Yes.
getting this hepatitis A. Ma'am, what will be like your final message to the parents and the all who are watching us? What will be your take home message?
Just keep your hands clean. Just use your food. Sorry. Yes, use your food after washing your hands. Vaccinate yourself and your kids with proper 2 dosing of this. And don't have outside foods, and don't use public toilets without proper sanitations.
Yes,
And one
definitely.
more thing I like to add in this,
Yes.
people carry sanitizer bottles with them. So I would like to tell them that hand washing with soap is even more effective in hepatitis A than this sanitizer, because hepatitis A virus is a non-capsulated virus, which is these alcohol-based sanitizer are not very effective. So it should be optional, not a replacement of soap water.
Definitely, ma'am. As it says, like the invisible threat, we don't know from where it will come, and risk factors are very high. We are already surrounded by it every minute. So
Yeah,
we are the one who has to take care of ourselves.
definitely.
So, with this, we'll conclude the program. Thank you for being a part of Immunize Talks. We
Thank you
hope
so much.
today's session was very informative and valuable in spreading awareness, as our topic says the invisible threat, reducing hepatitis A risk in high exposure environment. And ma'am, again, I would be special thanks, like dedicating this thanks to you, ma'am, from Dr. Shalu Goyal, who is from Faridabad, for sharing her time, her expertise, and insight with us today. For those who would like to revisit the program, the video will be available on our official social media platforms. Please follow us on Twitter, LinkedIn, Facebook, and subscribe to our YouTube channel. Do like, share, and spread the word as many as including your friends, family, and relatives, which will be saving them as well, and it will be informative for them as well. So until we meet on our next live talk, stay healthy, stay aware, and please take care of yourself. Once again, thanks, ma'am, being a part of it.
Thank you. Thank you.